Good morning, everyone, and welcome to not only the end of March, but also today's free webinar from ToHealth. This month, we've seen a plethora of health and wellbeing campaigns from International Women's Day through to Neurodiverse Celebration Week, World Sleep Day, and of course, Ovarian Cancer Awareness Month. So my name is Laura, and I'm delighted to be able to take you through today's webinar on Ovarian Cancer 101, where we'll be exploring the what, how and why. So ovarian cancer is a serious health condition that affects many women worldwide. So in today's webinar, we'll discuss what ovarian cancer actually is, the prevalence and who it affects, some of the modifiable and non-modifiable risk factors. So these are the factors that we can and those that we can't change. We'll have a look at the signs and symptoms. And here I'm going to actually take you through some emerging research from January of this year before exploring screening options, how to reduce the risk of ovarian cancer. And lastly, we'll take a look at some support for living with ovarian cancer. So a lot to get through today. So let's begin. And we'll kick off by understanding what ovarian cancer actually is and some of the functional changes of the ovaries without getting too heavy in the pathophysiology. So the ovaries are two small oval shaped organs in the pelvis, as you can see highlighted in blue on the image on your screen there. They're on either side of the womb and they are close to the fallopian tubes, which link the ovaries to the womb, and a layer of tissue called the peritoneum supports the ovaries. Specifically, ovarian cancer is characterized by the uncontrolled growth of abnormal cells in the ovaries. And these cells can divide and grow uncontrollably, forming a massive tissue known as a tumour. Now, the surface of the ovaries, fallopian tubes and peritoneum are very close together. So doctors think that most ovarian cancer starts within the cells at the end of the fallopian tube and then travels to the ovaries or the peritoneum. And ovarian cancer can affect anyone who has ovaries and fallopian tubes. This includes women, transgender men, and people assigned female at birth. And like many cancers, ovarian tumours can be benign or malignant. So benign means that the tumours stay in their primary location without invading other sites of the body. They don't spread to local structures or to distant parts of the body. Whereas malignant cells, on the other hand, grow in an uncontrolled way, and they can invade nearby tissues and spread to other parts of the body through the blood and the lymph system, which is known as secondary cancer. So that's a brief overview of what ovarian cancer actually is. So let's just next consider the epidemiology and the prevalence of ovarian cancer. According to Cancer Research UK, ovarian cancer is the sixth most common cause of cancer in women. In 2016, there were around 4,200 deaths from ovarian cancer, and it accounted for 5% of all cancer-related deaths in women. Staggeringly, that incidence rate is projected to rise by 15% in the UK between 2014 and 2035 to 32 cases per 100,000 women by the time we get to 2035. So it begs the question, why is this? Is it because testing and screening's better? Is research better? Or is it something a bit more untoward? Well, firstly, it's due to increased screening and awareness of vague symptoms, and this is something that we're going to touch on later on. But also because we are living longer than ever before. As a nation, our life expectancy is greater, so it's no surprise that this is much more common in older women, particularly those over the age of 50. Ovarian cancer is also more common in white women rather than Asian or Black women. However, the reason behind this is inconclusive. And lastly, 1 in 5 women with ovarian cancer are often diagnosed by the time they get to A&E, and many don't receive any treatment for their disease, often because they're too unwell by the time that they're diagnosed. Now, with that in mind, the prevalence of ovarian cancer is difficult to determine because it's often detected at such an advanced stage when it's already spread to other parts of the body. And this is why ovarian cancer is often referred to as the silent killer because it's difficult to detect, in those early stages. So being aware of the risk factors and being aware of the signs and symptoms is extremely important and something that I'd really like you to take away from today's session. So let's just start by having a look at some of those risk factors. Now, as I mentioned from the outset, the risk of ovarian cancer is increased by what we call modifiable and non-modifiable risk factors. So these are things that we can or cannot change or control. The first one here being age. As I mentioned in the previous slide, the incidence of ovarian cancer increases with age and typically peaks in the eighth decade. There's also genetic factors, firstly, such as gene mutations, particularly the BRCA1 and BRCA2 genes are tumour suppressor genes involved in DNA repair, and BRCA-related cancers result from mutation or alterations in these genes. Now, the lifetime risk of developing ovarian cancer is estimated at 28 to 44% for women with the BRCA1 gene mutation and 27% for women with the BRCA2 gene mutation. We also need to consider family history of ovarian cancer. About 3% of ovarian cancer cases occur in women with a family history of ovarian cancer. Particularly, the risk of ovarian cancer is 2.7 to 3.5 times higher in women whose mother or sister has or has had ovarian cancer compared to women with no such family history. And the risk may be higher, particularly if that affected relative was diagnosed at an early age. We also need to consider family history, though, of other cancers and not just family history of ovarian cancer. Again, the risk of ovarian cancer is higher in women who have had a sibling or have a sibling with melanoma or stomach, liver, breast, prostate, or connective tissue cancer, or who have or has had a parent with breast or liver cancer. Moving on to looking at some of the reproductive and hormonal factors. Firstly, let's have a look at conditions that increase the number of ovulatory cycles in late menopause. Evidence here from epidemiological studies shows that the number of ovulatory cycles a woman has in her lifetime is proportional to the risk of developing ovarian cancer. And there's also IVF treatment to consider. The National Institute for Health and Care Excellence, or NICE, states that the absolute risk of long-term adverse outcomes for IVF is low. However, using the available evidence that they have, it's not possible to completely exclude a small increase of risk of borderline ovarian tumours. And there is also a risk to consider with the use of HRT or hormone replacement therapy. There does appear to be a small increased risk of ovarian cancer associated with the current use of HRT, both estrogen only and combined HRT for more than 5 years. And lastly, if we have a look at medical conditions and lifestyle factors, any medical condition, particularly history of cancer of the ovarian, breast or bowel, is associated with that increased risk. And also endometriosis, evidence has shown that an increased incidence of ovarian cancer in women is documented with those with endometriosis. And lastly, there are some lifestyle factors to consider, and we'll have a look at these in more detail when we come on to exploring how to reduce the risk for ovarian cancer. But Cancer Research UK suggests that tobacco smoking, being overweight or obese, or even occupational exposure to asbestos can also increase the risk of ovarian cancer. So quite a few non-modifiable and modifiable risk factors there to consider. And as I mentioned, some of the key takeaways I want you to get from today's session are these risk factors, but also being aware of the signs and symptoms of ovarian cancer, or what we're terming this silent killer. Now, when we look at the signs and symptoms of ovarian cancer, what you'll probably notice here is that they're extremely vague and actually very common, and perhaps even symptoms that many of us have experienced or are familiar with. So, if we just take a look at the left hand side first and foremost, particularly ovarian cancer should be suspected and tests carried out in any woman, particularly if over the age of 50, if any of the following symptoms on that left-hand side are persistent or frequent. So frequent being particularly more than 12 times per month. And these include things like bloating, feeling full early on, any pelvic or abdominal pain, an increased need to go to the bathroom, and even symptoms that are suggestive with IBS or irritable bowel syndrome. And the possibility of ovarian cancer, and then again, that need to carry out tests, should also be considered in any woman who is reporting those unexplained symptoms that you can see on the right hand side. So these include weight loss, fatigue, and also changes in bowel habit. Now, I mentioned to you at the start this new research that actually came out January of this year, which I thought was really interesting to share with you today, particularly when we're looking at some of those key takeaways around understanding signs and symptoms. So, as we've just seen, the signs and symptoms of ovarian cancer can be really unclear in the early stages of the disease, which leads to some people actually, self-medicating and treating themselves with medication from a local pharmacy to alleviate their symptoms instead of going to a GP, as they might not think that their condition is serious. So this study by UCL, Imperial College London and the University of Birmingham considered if there is a link between buying history, so our transactional history with over-the-counter medication, and ovarian cancer over a 6-year period. The research actually included loyalty card data from 2 UK-based high street retailers of 273 participants. And of these women, 153 were diagnosed with ovarian cancer, which is about 56%. And on average, participants with ovarian cancer began to recognise some of those symptoms about 4.5 months before diagnosis. So really, the key outcome from this study found that the pain and indigestion medication purchases were higher in women who were subsequently diagnosed with ovarian cancer compared to women who didn't have ovarian cancer. And actually, some of those transactional purchases could be seen up to about 8 months before diagnosis. And I actually find this really interesting because the Cancer Loyalty Card Study, which is what this is called, is one of the leading projects showing that our health behaviours can be measured beyond healthcare records, actually using our transactional data, so what we're buying. And this data is really exciting for behavioural scientists to further explore lifestyle changes, dietary behaviours, and perhaps even exploring other data sets that can provide more information about self-care and health outcomes. So the cancer symptoms that we're looking for, and as we've just seen, are extremely common, but for some women, they might actually be the first signs that something is more serious and more untoward. So this suggests that long before women have recognised their symptoms that are alarming enough to go to their GP, they actually might be treating them at home with these over-the-counter medications. Therefore, it really is just being worthwhile and mindful of the signs and the symptoms that we've just explored, and particularly if they are persistent, then it would be encouraged to go to your GP. So GPs might look at, different ways in which we can screen. So it poses the question of how do we screen for ovarian cancer? And one of the most common ways of doing this is through something called a CA125 or a cancer antigen test. Now, a CA125 is a protein that's found in the blood, and raised CA125 levels have been associated with ovarian cancer. However, it's important to understand that there are a number of advantages and disadvantages, as with many different tests, before you request it. So if we just begin by having a look at some of those benefits, having a CA125 test could lead to an early detection of ovarian cancer and may increase the chance of that tumour being completely removed at surgery. But there are a number of limitations and risks which are really worthwhile being mindful of. The first question really is, does a raised CA125 result always indicate ovarian cancer? Now, a raised CA125 level could indicate ovarian cancer, and hence further investigations are recommended, such as ultrasound scans, further imaging, or even specialist reviews. But there are several other conditions that can raise a CA125, which are really normal and very common, such as normal menstruation cycles, pregnancy, endometriosis, fibroids, DVT, as well as any other intra-abdominal cancers, to name but a few. We also need to consider, if the result is in the normal range, does that completely rule out ovarian cancer? Well, unfortunately not. A negative test doesn't completely rule out ovarian cancer, and hence a physical examination may still need to be performed by a GP or a specialist for those further investigations, especially if you're still having signs and symptoms 4 weeks after that CA125 test has been performed. Now, I appreciate and recognise that that might actually sound quite confusing and quite conflicting. So I'd like to share with you a study which explored whether screening could be useful in ovarian cancer. So this study looked at 200,000 women between the ages of 50 and 74. Half of the group, so 100,000 people, were in the control group and didn't have any screening at all. Around a quarter, so 50,000 people, had a yearly ultrasound scan of their ovaries, and the remaining 50,000, so the remaining quarter, had this CA125 blood test once a year to measure the levels of CA125 in their blood. So this study started in 2001, and women could join up until 2005. And the researchers followed them up until 2020. So women on average were followed for about 16 years. So this is what we call a longitudinal study. And this meant the researchers could find out if either of the screening approaches, so either ultrasound testing or blood testing, could help save lives compared to no screening at all. So the researchers found that ultrasound tests couldn't find ovarian cancer early or save lives. The blood test did detect cancers earlier, but this didn't lead to saving lives. So researchers are now looking more closely at the information that they've collected, and this includes doing more tests on the samples that they have. Now, as a result of this trial, this is why there aren't any national screening programmes for ovarian cancer on the NHS, unlike there are for bowel cancer through what we call FIT testing. Now, this here combined with the vague signs and symptoms, like I said earlier, it might sound quite conflicting. So I just conclude here by saying that often women will go months on end with persistent signs and symptoms, and by the time they do go to the GP, those who get a diagnosis for ovarian cancer are at actually a much higher stage of ovarian cancer, meaning that life expectancy is far lower than when they have an earlier diagnosis. So if you are at a higher risk of ovarian cancer from some of those risk factors that we explored at the start of today's session, and or you have persistent symptoms, suspected ovarian cancer, then it would be beneficial to screen, and it would be beneficial to speak to your GP. Now, I've mentioned here about the benefits of early detection, and particularly preventative screening, and that behavioural science research that we looked at from UCL and Birmingham, looking at the over-the-counter transactions, could actually help to identify people who may have ovarian cancer at an earlier stage. And it really is one of the most effective ways to improve survival. There are no UK-wide statistics available for ovarian cancer survival by stage. There are survival statistics, though, available for each stage of ovarian cancer in England. And these figures that we're just going to explore in a moment are from people who were diagnosed between 2013 through to 2017. So as you can see here, that early detection really is important. Particularly women who are diagnosed at what we call stage 1, 95% of them will actually survive their cancer for 5 years or more after they're diagnosed. And as we transition through stages 2 and 3 and get to stage 4, we then actually reduce down to 15% of women will have a cancer diagnosis survival for more than 5 years after they're diagnosed. So the key message here is that early detection really is pivotal, and your general health and fitness might also affect survival. So we looked at some of those risk factors earlier on this morning, particularly such as age and family history that cannot be changed. But there is evidence that lifestyle can play a role in reducing the risk of ovarian cancer. And a healthy lifestyle can help to prevent the development of cancer and reduce the risk of recurrence in women who have already been diagnosed with ovarian cancer. So let's just have a look at some of the lifestyle changes that can reduce the risk specifically for ovarian cancer. So the first one that we've actually already mentioned is looking at maintaining a healthy weight. Being overweight or being considered obese is a risk factor for many cancers, not just ovarian cancer. So maintaining a healthy weight is really key to help reduce the risk. And even though obesity poses a small potential to increase the risk of developing ovarian cancer, it's really important to consider your body weight, diet, and also your overall health. We also need to consider a healthy diet, particularly a diet that is rich in fruits, vegetables, and whole grains, and low in fat and processed foods can reduce the risk of ovarian cancer. Some studies have shown a reduced rate of ovarian cancer in women who ate a diet high in vegetables or low fat diet, whereas other studies disagree. Now, even though the effect of these dietary recommendations, particularly and specifically on ovarian cancer risk, remains uncertain, following them can help prevent several other diseases, including other types of cancer. It's really important as well that we maintain a good level of physical activity. Particularly women who are physically active are less likely to develop ovarian cancer than women who are inactive. Particularly, studies among ovarian cancer patients have shown that 1.5 hours per week of moderate intensity exercise, so anything that makes you a little bit out of breath and sweaty, so for example, brisk walking, running, jogging, it correlates with a 33% lower risk of mortality in years 1 to 4 post-diagnosis. And lastly, we need to consider alcohol consumption. There is strong scientific evidence that alcohol consumption can cause several types of cancer. Whilst numerous studies have examined whether there's an association between alcohol consumption and the risk of other cancers, particularly those of the ovary, prostate and stomach, there is a little direct correlation. However, alcohol consumption can be associated with the increased risk of other what we call non-communicable diseases, but also the risk of secondary cancer. So it is advised to stay within the guidelines and consume no more than 14 units per week, and that's for both men and women. Now, as we draw towards the end of today's session, it's really pivotal that we have a look at living with ovarian cancer. It goes without saying that living with ovarian cancer and any other cancer for that matter, it can be a challenging experience. But it's important to know that there are an abundance of resources and support available to help manage the physical, emotional, but also mental aspects of the disease. You might have lots of emotions to cope with when you're diagnosed with cancer, and treatment for ovarian cancer can cause changes in the body, which affects how you feel in yourself. So coping with diagnosis and treatment can be overwhelming, but finding a support system that includes healthcare providers, family, friends, and support groups really can make a difference to you, but also friends and family around you. First off, after a diagnosis of ovarian cancer, you might have a range of feelings, which might include fear, sadness, anxiety, depression, or none of the above. And these are completely normal responses to a stressful life experience. And as I said, not just for you, but also your loved ones as well. Everyone reacts in their own way, and sometimes it's hard to take in the fact that you might have cancer at all. So try to take each day as it comes. Stay active, eat well, try and maintain a healthy lifestyle, and you might even find techniques such as drawing or keeping a journal really helpful. The advice from Cancer Research UK in terms of support systems is simply to talk to friends, talk to families, but you might also find it really helpful to talk to somebody who's completely impartial, such as counsellors or nurses. And actually, on the next slide, I'll give you some of those support resources for that actual support system. You might also experience physical changes, including changes to relationships. These might include hair loss, hormonal changes, even changes to your sex life. And I'd really recommend taking a look at some of the guidance and support from Cancer Research UK, because they've got some superb recommendations for a multitude of different physical symptoms that you may experience. And lastly, we need to consider practical ways of coping. You and your family might need to cope with some of those practical elements, such as money, financial support, such as benefits, sick pay and grants, work issues, travel costs, or even changes to your home. So here you can talk to your doctor or a specialist nurse to find out what can help, or even utilise your company's employee assistance programme, which if you're with PAM Group, many of you might be familiar with PAM Assist. And getting help early with these things can really mean that they don't become a big issue later on. So here are just some of those support mechanisms and support systems that I was talking to you about. Some of the organisations that you might find useful include the Eve Appeal. They offer information and support for anyone who's affected by gynecological cancers, and they can also provide information about cervical screening and for trans, non-binary and intersex people. You have Overcome and also Target Ovarian Cancer, both with some really useful support lines where you can talk to some of their specialist team. And lastly, we've got Macmillan and Cancer Research UK, which many of us, are very familiar with. And again, both can offer that emotional, practical and financial help and support, as well as actually having access to forums to also talk to people who have been affected by ovarian cancer and share those experiences and ask experts any questions that you might have. So as we're drawing now to a close, we've gone through a lot of information today in such a short space of time. So let's just do a quick summary. We know that ovarian cancer is an uncontrolled growth of abnormal cells in the ovaries, and it affects anyone who has ovaries and fallopian tubes. We've identified those risk factors to be aware of, but also the symptoms of ovarian cancer, which can be extremely vague and common. So, as I've mentioned before, my key takeaway for you here is be aware of those risk factors, understand and know what those signs and symptoms are to allow for that early intervention and that preventative screening, because it can help identify ovarian cancer at a much earlier stage. And certainly, if you have any of those risk factors or symptoms that we've explored, it's well worth speaking to your GP to get that early support. And lastly, if you are living with ovarian cancer, as well as any other cancer, it can be a challenging experience, but there is an abundance of support out there to help you both physically, emotionally, but also mentally as well. So thank you as always for your time on our sessions. We do value your feedback. It helps us to understand what you enjoy from these sessions. So please leave some feedback for us. You can either scan the QR code or visit the website, and the link will be available for you in the chat. And if you are interested in any of the health screening options that we provide at ToHealth, which includes both health assessments, but also standalone ovarian cancer screening, that's CA125 that we talked about, then do get in contact with our team. You can reach us on our email address, enquiries@tohealthlimited.co.uk, or give us a call and we can talk you through that in a little bit more detail. So thanks again for joining me. I hope you have a really great weekend when it comes, and we look forward to seeing you on the next session from ToHealth. Take care.